Good morning, all. Is it audible, ma'am?
Yes, sir. Good morning, sir.
Yeah, my voice is audible.
Yes.
Okay. So today we are going to discuss about the chiral drugs, and you know that the drugs. Okay, so the drugs. What are the drugs generally? So where the drug is which gives a disease is a drug. Yeah. So in case when that particular your biological system is deviated, altered here. Okay, so then some uncomfortable condition is arised. That condition is called the disease here. So in that case, to bring that deviated system into normal way, so we use the drugs here. So where the drugs will be means it what is that particular problem, and it will be right. So repair that system. Okay, so it brings that deviated system into normal mode. Okay, so that is the drug, you know, that the introduction and the definition of drugs and disease. So already we discussed in the very starting class here. And the chiral drugs here. Generally, what is mean by chirality here? So when that particular compound, right? So when that central carbon atom is, when it is attached with the four different groups, then we called it is the chiral compound. Okay, so chirality nothing but when that attachment of the central carbon is with the four different groups here. Like you see, when the central carbon is having A, B, C, D. So this kind of, because the carbon is the valency of carbon is four only, and when it is attached with four groups A, B, C, D. So like that. In the A, B, C, D in the sense you can take the difference like methyl, ethyl, or any phenyl groups here. So we call that is the chirality. Okay, having the different groups, that is attached of different group is a chirality. And the chirality, it plays a very important role in the drug chemistry. Okay, because in the pharmaceutical chemistry or in the medicinal chemistry or in the drug chemistry, the chirality it plays very important role. Okay, because when generally you know that the chirality, so it is very specific in the nature. Okay, so the compounds, you know that the specificity. Okay, stereospecificity. When, for example, here when we are having the two compounds like enantiomers, isn't it? The enantiomers are the diastereomers. So these are the specificity of that compound here. So and this enantiomeric nature is acquired due to the having that particular right. So the chirality. Okay. So when we are taking the two isomers here, two isomers like A and B, right? So where the A compound is active, okay, that is active towards that biological activity, and compound B is not active here. Okay, so both are isomers only. You know that what are the isomers here? So basically, the isomers are where the having the same molecular formula and showing the different properties like physical properties and chemical properties here. They will show the different properties, and this difference in the properties is due to their what is it, the location, okay, the orientation of that groups, okay, having the groups, the position of that group. For example, in the you know that enantiomers. So here, right? So here you see this is a compound where okay, A, here is a B, here is a C, here is a D. Okay, and another isomer for this is where you can see this here is a D, there is a B here, is a A here, here is a C. Okay, so you know that in this particular compound, this is compound one, this is compound two. In both cases, right, you can see the all groups are same. You see, here A, here also A, here D, here is D, here B, here is B, here is C, here is C. So you see that same kind of compounds is there. Same kind of attachment or the groups are present in the both cases here. But only thing is the orientation. Okay, where in this compound one, you can see that the location of your orientation of your. Okay, so this D group is on the left side here, and in the compound two, where the D is attached on the right side here. Only okay, the position of the groups is different. Okay, so where A and C is same in both cases, where the B and D, these groups are okay, the oriented in the different sides here. In the compound one, you see the D is in the left side, and in the compound B, or the second compound, where the D is on the right side. So due to this difference, due to this the location or the orientation of that groups, right? So it is having okay, it brings up changes in their activity, physiological activity or the biological activity or the medicinal activity there. Okay. So where your chiral drugs explains the difference, right? Means the different properties of these isomers, right? Due to the different orientation, spatially oriented the groups here, right? So how they will impact and how they will shows the difference in the biological activity and what are the compounds which is affecting that right, the biological activity and how much the impact is there. So we will see in this particular topic here. Okay, and due to this orientation or the difference in the location of the groups here. So one compound is, it is having, for example, you see here is compound one is, if you assume it is biologically active, where it is having the pharmacological activity, and compound two is not having the activity. Okay, only due to the difference in the orientation of the groups, right? It is losing its pharmacological activity or the biological activity, right? So that is explained in this particular chiral drugs here. So we'll see some examples in here. Yes. So here, where it is giving ibuprofen, you know, means we know that it is a brufen tablet. Okay, the brufen, so where it is a anti-analgesic tablet here, right? Where the means where it reduces the pain. Okay, so anti-analgesic, right? Ibuprofen. Yes. Yes. Right. So here we have the two isomers here, IS ibuprofen and R ibuprofen here. Okay. So in this ibuprofen and R ibuprofen, you can see this. So here, how many chiral centers are there? So generally, we can see only one chiral center. So this is your chiral center. So yes, I am getting some disturbance. Please keep mute here. Yes, you know that, right? So here you see this is only one chiral center is there here. Okay, this is the chiral center. So you know that so the enantiomeric pairs. Okay, so the number of enantiomers you can calculate with this right, one chiral center, that is 2 power n here, right? You know that. So here the 2 power n equal to 1, that is equal to 2. So 2 isomers are possible for this particular S ibuprofen here or the brufen. Okay, and in that one is S ibuprofen and R ibuprofen. And one more example is given with the ephedrine. Okay, so in the ephedrine, see the two isomers, two chiral centers. Right, here there are two chiral centers. This is one, and this is another here. So there are two chiral centers here. So here the n equal to 2. So 2 power 2, it is 4. Okay. So there are 4 isomers are possible for this ephedrine. Okay. So ephedrine. So in this way, like if n equal to 3, then how much it is? There are 2, 4. Okay. So 2, 4, 4. So there are 8 isomers are possible. Okay. So with increase of n number here, so where the isomers, right? The isomeric pairs, enantiomeric pairs will be increases. Okay. So see this, and among these four right? See the four isomeric pairs where 1, 2, 3, 4. It is labeled 1, 2, 3, 4 here. And among these, the compound 1, okay, and the compound 2, right? So compound 1 and compound 2 is a enantiomers here. And same way here the compound 3 and 4 are the enantiomers here. And the compound 1 and 3, right? And compound 2 and 4 are the diastereomers. Okay, you know that what are the enantiomers here? Where the enantiomer nothing but, okay, the isomer, the stereoisomers, which are, right, non-superimposable mirror
Mirror
images
image
here.
superimpose.
So here there are four isomers are possible. Among these, where you can see 1 and 2 and 3 and 4, these are the enantiomers here. And 1 and 3 and 2 and 4, these are the diastereomers here. So enantiomer nothing but where the isomers, okay, non-superimposable mirror images are called the enantiomers here. And here the non-superimposable and non-mirror images, these are called the diastereomers. Okay, so that is a definition of enantiomers and diastereomers. Now we will see that the relationship between the chirality and biological activity here. So what is the impact and what is the effect of that particular uh, chirality on your biological activity? We can see, right? So there are some cases, some conditions are there. So you see that, yeah. Okay. So here in the main principle of your drug chemistry is where the drug receptor interaction here. The drug chemistry main principle is you aware of that one where this is your receptor, for example, right? Okay, so this is your receptor. There is receptor here, and every receptor is having its own cavity. We call that cavity is the active site. So your drug compound will be right. So the drug compound will be occupying this receptor active site here, right? So it okay, so it approaches this receptor active site and it sits in it. It occupies this receptor active site. So when this drug is okay, this is your drug. Sometimes we in the absence of drug, where the natural neurotransmitter NT. Okay, natural neurotransmitter is occupying this receptor active site. Right? Okay, so here when this drug is occupying this receptor active site, then your receptor gets activated or it is stimulated here, and it is release some kind of chemical messenger. It release some chemical messenger, and that chemical messenger is operating your metabolic process. That is a procedure of that is a principle of your drug chemistry. Okay, and you know that where the receptors are in chiral nature. Receptor active site is in chiral in nature here. Okay, so it can recognize the drugs, okay, or the ligand chiral nature, right? So it able to recognize the uh, chirality, and it discriminates the enantiomers and the diastereomers here, right? The enantiomeric pair will be discriminated or the differentiated by your receptor active site because it is in the chiral nature. So where the two isomers, for example, A and B, two isomers are there, right? So only one isomer can be fit in this particular receptor active site, and another cannot be fit into the receptor active site. That is due to having that chiral nature of your receptor active site. Okay, due to this chiral nature, so we can able to we can able to discriminate the that particular enantiomers in the in vivo method here, right? So you know that in vivo is nothing but where the action takes place inside the living organism. Okay, so you it's the impact of this. Uh, okay, so where the is chiral nature. So one compound is having more, right, and another compound is having less activity as a zero activity here. Okay, or inactive generally. So generally the compound which is having more biologically active is called the eutomer here. Right? So the eutomer and the distomer, these are the two terminology which is used for to discriminate this particular uh, enantiomers here in the chiral chemistry. So where the active enantiomer of a chiral drug is called the eutomer here, and the inactive enantiomer or the inactive isomer is called the distomer. Okay, eutomer, eutomer and distomer here. These two terminology are these two names which are frequently used in your particular chiral chemistry, right? So eutomer nothing but okay. What is eutomer here generally? Eutomer is a the more active compound, right? The more active enantiomer of your chiral compound or the drug compound. Okay, and the less active or the inactive compound of your chiral drug is called the distomer, right? So, for example, we can explain this eutomer and distomer by taking the S-propanol. S-propanol, it is antihypertensive drug here, right? So it is a antihypertensive drug here. Okay, so where this S-propanol, it is 130 times is more reactive than the R-propanol, right? So only thing is the difference in the location of the groups, right? So where both R and S propanol drugs or the compounds are carrying the same number of carbon, same number of hydrogen, same number of oxygen, same number of groups here. Only the difference is where they will, the orientation of the groups, right? So in one isomer where the, for example, you take methyl, for example, right? So where it is oriented in the left side, and in another isomer where the methyl is oriented in the right side. So only due to this difference, right? So where the S isomer of your propanol, it is 130 times more active than your R isomer. Okay. And that's where the S propanol is the etomer here. It is S propanol is a etomer and R propanol is a histomer here. Okay. So it is very important question, and means in the exam, repeated question in the examination, they will ask the define the etomer and distomer with example, right? So in that case, what you do? Simply you you define the both the terminology here. What is etomer and what is distomer? You write the definition of both thing, and you give one example like S propanol. Okay, or any you can take any other example here, right? So, for example, we are taking S propanol here. Here the propanol. So in the propanol we have S propanol and R propanol. So where the S propanol more active here, so it is called as etomer, and R propanol is less active, so it is called a distomer. Okay, so this is the etomer and distomer definition here. Now the Edesmic ratio. This is also one of the important small. What is the question here? Which is expected in the examination, where the etomeric ratio. Okay, and sometimes they will ask define the etomer and distomer and Edesmic ratio. So they will ask by these three terms here. Okay, depending on the weightage of that question, right? Marks. Yes, so they will ask this. Edesmic ratio. Here the Edesmic ratio nothing but here the activity of etomer, activity of distomer. It is a ratio. Okay, it is a ratio between the activity of etomer by activity of distomer is called the Edesmic ratio, right? And the Edesmic ratio is one of the important criteria to decide the dosage of your drug, right? So while deciding the dosage, okay, while prescribing the doses, they will consider of the Edesmic ratio. Okay, Edesmic ratio nothing but the activity of etomer by activity of distomer. Means the activity of more active isomer and the activity of less active isomer. For example, if you take in the propanol, where the activity of etomer is 120 and the activity of distomer of propanol is 0. So it is 120 times. Also, that is a definition of your Edesmic ratio. And that's some condition. If the Edesmic ratio is more, the drug is more effective here. And means you know that, right? So where the Edesmic ratio is a deciding factor to decide the dosage here. Okay. So based on that Edesmic ratio, we'll decide the dosage. When the Edesmic ratio is more here, then we call the drug is more active. Then where it requires less dosage. And if Edesmic ratio is less, then the drug is less active. Then the quantity or the dose of your drug is must be more. So that is we can decide the dose based on your Edesmic ratio. Okay. Then case studies of Edesmic ratio. Okay, this is one of the important long question here, right? So which can be expected in the examination here. So very important question where the case studies of your Edesmic ratio. So here some cases are right listed here where means in case of the etomer and distomer, how it will be impact and if together etomer and distomer how they will be impact and singly how it will be impact. So you can see some list of some list of studies under this Udismic ratio. First, we'll see the case number 1, where the distomer shows serious side effects. Distomer. What is distomer generally? Where the inactive isomer of your chiral drug. Inactive isomer of chiral drug is called the distomer. So, distomer shows serious side effects. This is the case. This is the case here. And we'll have some example under this case here. Here the right. So the example where the S-precoline is an anesthetic drug here, and where R-precoline this causes serious side effects such as hallucination and agitation. So here S-precoline is an anesthetic drug, and R-precoline cause serious side effects. So in this case, right? So we know that effect of the side effects or the effects of your S-precoline or precoline. So in that case, we cannot consume this drug in the racemic form here, right? In case if you are not resolve the compounds, racemic mixture, if you are consuming this precoline in the racemic form, right, then you can see the serious side effects of your distomer here. Right? And what are the side effects you will observe here is hallucination and the agitation here. So hallucination, you know, that some kind of unconsciousness. And agitation where that some disturbance in the CNS or that kind of that you can observe. So this particular precoline drug should not be taken as the racemic form. And one more example under this Udismic ratio is the penicillamine is anti-arrhythmic, whereas the penicillamine is carcinogenic here. And you know that what is the carcinogenic, which cause the cancer. Carcinogenic nothing but which cause the cancer here. So in the penicillamine, so you know that penicillamine is a antibiotic here. So penicillamine. So in this particular penicillamine, penicillamine is arrhythmic drug here. So arthritic drug. So arthritic, you know that where the joint pains, some inflammation. It is a kind of anti-inflammatory drug here, right? So penicillamine is anti-arrhythmic drug, and where penicillamine is carcinogenic. So we cannot take these penicillamine and penicillamine combinedly here, because we are having this kind of carcinogenic effect with the mutation. So it is better to avoid that the racemic form here. Next, one more example is given. Ethane butanol. Ethane butanol is anti-tuberculotic, and R ethane butanol, it causes blindness. So effect of these where the S and S ethane butanol, right? This is one of the kind of drug here, S and S, where the configuration is S and S here, and R ethane butanol, it causes blindness. S and S ethambutanol is, it is tuberculotic tuberculosis, you know that, TB. Okay, it is anti-TB drug here. And where the R and R ethambutanol, it is causing blindness. So you must separate these two isomers, okay, while you are synthesizing this drug. And obviously, when you are going to synthesize these chiral drugs here, so we'll get the isomers together here. Okay, we'll get the enantiomers, like okay, yeah, R and S. So we'll get both isomers. Okay, so you have to separate the both isomers. Sometimes what happens here, when it is impossible to separate these okay enantiomers here, then we will try to take in the racemic form, right? But if the okay, the one isom both isomers, right, not interrelated, or both isomers are not causing the more effect here, then it is you can go with this racemic form here. But when the one isomer is showing serious side effects here, then definitely you have to separate that isomers here. Means we know that that process is called the resolution here, where the separation of isomer is called the resolution. So you have to resolve the isomers, right? So where you see the S and S ethambutanol is, it is anti-tubercular, and R and R ethambutanol is, it causes blindness here. This is the structure of your ethambutanol. Okay. So here it is having the one chiral center. Okay, here is one chiral center. So you have the S and S ethambutanol. Yes. And case number 2, distomer shows no serious side effects. Case number 1, it explains the distomer is having serious side effects here. Okay, and under that we seen some examples. And the case number 2 is distomer shows no serious side effects. Okay, so it is not a problem where the distomer is not showing serious side effects. Okay, example, you see the beta blockers like S-propanol and S-metoprolol and S-atenolol. So all these are the beta blockers here, means antihypertensive drugs only. Okay, all these are the antihypertensive drugs, and they act as a beta blockers here. Okay, so like we have in the right, okay, in the smooth muscles we have 5 receptors like alpha, okay, alpha, alpha and alpha prime, beta and beta prime here, and gamma. So these are the 5 receptors, we know that. Right. So in this, where the S-propranolol and metoprolol and atenolol, all these are the antihypertensive drugs, where they are acting as a beta blockers here. And S isomer is eutomer. Okay. And these are marketed as racemates because it is difficult to separate the enantiomers, and distomer does not show any serious side effects. Yes. So in this case, where the, if you see the, if you take S propranolol or the S metoprolol or the S atenolol in all these drugs here, okay, in all these drugs, the S isomer is a eutomer. S isomer is a eutomer, means S isomer is a less active compound or inactive compound, inactive drug, and R isomer is a active drug here. Okay, and it is difficult to separate these R and S isomer, R and S isomer like atenolol or the propranolol or your metoprolol here. Okay, so it is difficult to separate these racemates, these isomers here. And here the condition is the where the eutomer is not showing side effects. Okay, so it is not a problem if you take this drug as the, or if you market this drug as a racemic form here. Racemic form means racemate. What is racemate here? where the combination of enantiomer, combination of S isomer and R isomer here. Both the isomers. Okay, S and R, both. So due to the difficulty in the separation of these isomers, and due to there is no side effect of your S isomer, so market or you can take these drugs as a racemate form here. Next, case number 3, you can see enantiomers show independent therapeutic values here. Okay, here the third case is where both the isomers, both the enantiomers here, like R and S, okay, both are having the activity. Okay, both are having the biological activity. But in that one is having, obviously it is one is having the more activity, another is having less activity. Okay, and both are having the therapeutic activity, independent therapeutic activity. Okay, here example is given where the 2R and 3S dextro propaxifene. Okay, 2R 3S propaxifene anti, whereas the opposite isomer where the 2S and 3R levopropaxifene is anti-tissue here, right? So in here the both both the isomers like R and isomers having the individual individual independent therapeutic activities here, biological activities, right? Like where you take for example so you paracetamol or the aspirin. Okay, so you can the aspirin, you can use this aspirin for as a antipyretic drug, and same this aspirin also, okay, it is taken for the what is that painkiller. Okay, anti-analgesic, antipyretic. It reduces fever and it reduces pain. Painkiller, it is acting as the painkiller as well as your acting against the fever here. Means it is having multiple effects here, multiple uses. Okay, same kind here also, where the both the enantiomers showing the independent therapeutic values, and the example is given where the 2 or 3S, okay, propaxifene, where it is analgesic, means it is analgesic nothing but what is analgesic here, where the drug which reduce the pain. Okay, it's reduce the pain here, and 2S3R, where the levopropaxifene is anti-tissue. Okay, it is cough reducing agent here. Okay, so both are having independent individual activity. Next, case number 4, where combination therapy. Okay, combination therapy. So this is one of the some different category or the case here, where the distomer acts as an antagonist for undesirable side effects of the eutromer. Okay. So with or indacrinone is diuretic and effect is uric acid retention. Okay. So in the combination therapy. Combination therapy means combined therapy here. Okay, combination therapy, nothing but the combined therapy. So where here is a number, means inactive compound or the less active compound or less active drug, which is acting as an antagonist for undesirable side effects of the eutromer. So here the etomer nothing but more active compound. Here the etomer or the more active compound, it is showing the side effects. Okay, it is having here more, and also it is having some side effects here. Okay, it is having the biological activity as well as the side effects. Okay, and where the other isomer like less active compound, where the distomer, it is an antagonist for this side effects of your etomer. Antagonist. What is agonist, antagonist here? Here the antagonist. Okay, agonist is, okay, so when, okay, agonist, when that particular, right? So when that particular drug or the compound, right, is having the, right, having the less production, then so we can increase by, okay, we can increase by the agonist. And antagonist means when actual production is more, okay, when the actual production of your natural neurotransmitter is more, okay, when the actual production of your chemical messenger is more here, then to reduce other to decrease the chemical messenger, we use the antagonist here. Okay. So in this case, where the etomer, okay, the etomer is having the biological activity as well as the more side effects. And when you are using this distomer, it is reducing the, okay, it is reducing the side effects of your etomer. So here the example is R-indoctrinone is diuretic here, and its side effect is uric acid retention. Okay, so indoctrinone or indoctrinone, it is diuretic here. Diuretic means where you know that uric acid is secretion. What is called we the disease is polyuria. Okay, sugar, just enough. Diabetes. Okay, so here the indoctrinone, it is diabetic drug here, and it is having the, okay, it is useful for the, it is used as a anti-diabetic drug here, and it is having some side effects where it is uric acid retention, where the uric acid, it right, it won't excrete the uric acid. Okay, it won't excrete the uric acid. So if uric acid does not excrete from the urinary system, then the concentration of uric acid going to increase. Then it causes for the, right, means that is hyper diabetic here, right? So this particular distomer, okay, yes, indoctrinone, right? So where it is acting as the, okay, it is it is excrete the excess of uric acid, which is retained, okay, it is retained by your R indoctrinone here. Okay, so it increases the uric acid excretion. And number 4, where you see this metabolic chirality inversion. Okay, metabolic chirality inversion. So chirality inversion. Chirality inversion means changing its chirality. Like R becomes S, S becomes R. Okay. And this inversion or the conversion, inversion or the conversion of the chirality, right, it takes place inside the living organism. And it is changing of the chiralities due to the metabolic process here. Okay, here the example is given like aryl propionic acid. Aryl propionic acid. So here this aryl propionic acid, when these drugs are administered as racemates here, the distomer is converted to eutomer in vivo. So this is your R-ibuprofen. Okay, R-ibuprofen here. And when it is R-ibuprofen is, right? So when it is treated with the some coenzyme A, acetyl coenzyme A here, okay, this is acetyl coenzyme A, right? So where this acid, right? So it is converting into that R-ibuprofen acetyl coenzyme A. Okay, R-ibuprofen, R-ibuprofen coenzyme A. Then under this R-ibuprofen racemate, okay, ibuprofen racemate here. So where this the conversion of the stereochemistry, right? The inversion of the stereochemistry is taking place. Okay, so here is, for example, here is R, right? So here is R configuration here. This is R configuration, and where the in the presence of this R ibuprofen racemate, right? So this is the engine. It's kind of see here the acetyl coenzyme here. It is coenzyme here. This is coenzyme here. This is the engine here, and where the stereochemistry inversion is taking place here, right? Here is a R and here is a S. Okay, here you see this is above the plane and this metal is okay out of plane here, below the plane, right? And upon hydrolysis, you can see where this okay, upon hydrolysis, where this coenzyme is gets hydrolyzed and you can get your acid. So what is happening in this here? Where so here this R ibuprofen converting to S ibuprofen due to enzymatic reaction. Due to enzymatic reaction, the R is converting into S ibuprofen. Okay. So here let's see when we are taking the racemic form, right? So one compound is generally, if, for example, here R ibuprofen, it is not having the it is not generally R ibuprofen is inactive compound. It is a distomer of your ibuprofen. Isn't it? R ibuprofen is a distomer, or the inactive compound here. So we are making this R ibuprofen as active compound by treating with the enzymes. Okay. So here the R ibuprofen, when it is treated with the acetyl coenzyme A, so we are getting your R ibuprofen coenzyme A, then in the presence of R ibuprofen racemate, and followed by the hydrolysis, where it is converting into ibuprofen. So where the inactive becomes active, right? So for this, where it is taking place inside the living organism. Okay, it's taking place inside the living organism. Generally called that is the in vivo. Okay, we have that in vivo, in vitro. Okay, so we have what is in vivo here? Inside the living organism, and in vitro. Okay, in vitro where inside the means outside the living organism. We call the laboratory synthesis. In vitro is the laboratory synthesis, and in vivo is the biological synthesis. Okay, biosynthesis. We call this is biosynthesis here, and this is your laboratory synthesis. Okay, so these are some 5 cases in the chiral threads. Okay, so the case one is when the eutomer is having serious side effects. Then the second case, eutomer is having less side effects here. Then combination theory here. Okay, and when this particular right, so both the enantiomers are showing the independent biological activity and the combined theory. So and metabolic hierarchy inversion. So this is very important questions which can expected for the long question. Okay, so very simple where you can give the definition of etomer and isomer and rheosmic ratio. Then you give some cases. There are 5 case studies here. Okay, in that 5 case studies, first you keep heading up your okay, that effect of that isomer here, and you give 1 or 2 examples. You explain with 1 or 2 examples here. Okay, so this is the chiral compounds cases here, case studies. Then contact model, enzyme inhibition, and very beginning I told okay, where your enzyme receptor active site or the enzyme active site here. Receptor, nothing, enzymes, proteins, carbohydrates, all these are acting as a receptors here. Here, this enzymes, okay, enzyme active is specific in nature and chiral in nature, right? Recognize or intimately announce that will be explained by enzyme specific is explained by 3-point contact model where the isomer can separate. So you can see the 2 cases. We can this for example in both diagrams. So you can see okay. So where this receptor active site, okay, the active site that like amino acid 1, amino acid 2, amino acid 3. Okay, these 3 points here. amino AA1, AA2, AA3, and your receptor, okay, ligand, the drug, okay, we call that is a ligand or the drug or the national neurotransmitter here, means exterior compound, okay, external compound, we call that is drug compound or the national neurotransmitter or the ligand compound. So where it is having 3, right, 3 groups, right? So it is shown with this 3 different shapes, like one is a round shape here, oval shape, and there is a triangle, and there is a rectangle here, right? So that these 3 contact points are there, and these 3 contact points able to form the interaction or the hydrogen bonding with your receptor active site, and you can see where this 3 are forming the interaction with your receptor active sites enzymes. Sorry, amino acid, like amino acid 1, amino acid 2, amino acid 3. And in another case, you can see, so same kind, same receptor active site here. Okay, there is no change in the receptor and the receptor active site. So same kind of contact points are there. Okay, like you see amino acid 1, amino acid 2, amino acid 3. And the stereochemistry of your ligand or the drug is changing here. Okay, so where it is inverted, you see, where in the first case, where the rectangle and triangle, okay, so here the rectangle is in the left side, where the triangle is on right side. In second case, where it is inverted, where the triangle comes in this left side, where the rectangle comes in the right side. Okay, so you can see, and here where there is no change in the position of your the round oval here. And in the second case, so only one oval shape. So means all these are the shapes are considered as the groups here. Okay. So this group, one group is having the interaction with amino acid 2, and there is no interaction found in amino acid 1 and you can observe where in the first case where it is having the interaction with 3 residues here, having can found the three interaction with three residues, amino acid 1, amino acid 2, amino acid 3 here. And amino acid here you can see only amino acid 2 only having only one interaction. So you can see the difference here. So both isomers can be discriminated with this criteria. Okay, so this is called your right. So this is called the 3-point contact model. And in the current scenario, with in the rational drug designing using the computer graphics is the sophistication of 3-point pattern. Right. So generally, you know that in present days, okay. So in present days, where there's CAD technology, okay. So the CAD technology, CAD nothing but computer aided drug designing, okay. And this the computer aided drug designing is following or it is uh, okay, it is following this kind of interactions here, right? And it is more useful for this designing of drug contact model and some other okay specificity, enzyme specificity like lock and key model here, okay, induced fit model, 3-point contact model. So these are theorems which means the specificity of the enzyme specificity. And yeah, and next we are going to see classification of chiral drugs. So in the classification of chiral drugs, we have various types of drugs and various classification of here, and we'll see the NSAIDs. With the non-steroidal anti-inflammatory drugs here. NSAID, non-steroidal anti-inflammatory drugs. So where these drugs are analgesics here, we call analgesic nothing but okay painkillers. Okay, these are the painkillers here, and yeah, the steroids is known to be painkiller generally, but they are produce side effects here. Okay, so like you know that steroids, right? So to get relief from these pains, generally some people are using the steroids here. They are taking the steroids here, but it is not advisable. It is not good idea because it is having severe side effects here. So where we are going to use the non-steroidal anti-inflammatory drugs, and they are very important and useful in the medicinal chemistry. And so examples, we can see this beta blockers. So the beta blockers, these are the anti-hypertensive drugs, and AC inhibitors. And AC inhibitors, this is nothing but angiotensin converting enzyme. Okay, so angiotensin converting enzyme. So angiotensin, right? So angiotensin is a chemical, right? Angiotensin, it is a chemical messenger, and this when this particular okay production is going to increase, then heart attacks, the hypertension here. It's development. In that case, we use the AC loss. Okay, potential chemical measure is percentage increase here. So when the activated, more activated here. So angiotensin, you know that angiotensin is a chemical which is it is a decapeptide here. Okay, this decapeptide converting into octapeptide. Right? Here is a angiotensin 1. Okay, and it is angiotensin 2. In the presence of angiotensin 1, it is a decapeptide here. Angiotensin 2 is a octapeptide. Okay, so angiotensin 1 decapeptide gets hydrolyzed in the presence of AC, angiotensin converting enzyme, and it is leaving two peptide bonds, and it is converting into angiotensin 2 as a octapeptide here. Okay, so two peptide bonds is hydrolyzed and it is converting into angiotensin 2. So this is a regular process where takes place in the smooth muscle. And in case when this angiotensin converting enzyme gets overactivated, overstimulated, so when this AC gets overstimulated here, so due to some due to our lifestyle or due to that factors, okay, so where this right, so when the AC get overactivated, so more conversion of AC to takes place over the okay, it was for the development high rate. In that case, you need to inhibit the activity of your angiotensin. So for that, generally we use the antihypertensive drugs like captopril, okay, captopril, enalapril here. So these are the drugs which are uh, blocks or which are inhibit the angiotensin converting enzyme, and it brings that high BP generally. Okay. So here, all the chiral drugs contain at least one asymmetric center, and which is responsible for its biological activity. And the only one isomer is useful biologically active, and the other isomer is not be the harmful generally. Okay, and here the NSAIDs, some example already we have seen. There is a alpha aryl propionic acid, where it is this is a common structure of NSAID, and here is ibuprofen. Okay, naproxen and oxaprozin. So all these are the NS. Some other drugs are given like beta blockers here, propylamine here, atenolol here, okay, and acetbutamol. So all these are the drugs which are acting as your NSAIDs, non-steroidal antibiotics. And in the AC inhibitors, the example is captopril. This is one of the important, very effective drugs, which is useful to reduce hypertension here, to reduce low, which reduce your blood pressure, BP, high BP here. And sometimes we use lisinopril also, and ramipril, lisinopril. So all these are your different antihypertensive drugs. Next, very important question asked for the 4 marks is Piper's rule, right? Yeah, the Piper's rule, where which explains the the Piper's rule, which is useful to decide the dose here. Okay, so when a more active pure enantiomer is used, the higher the rhythmic ratio and lower dosage of drug required. This is known as 3%. Okay, 3%, sometimes called it 5%. So 5%, okay, it explains the deciding of the dosage here. Okay, how the dosage is decided, and you know that the dose description or the dose deciding is depending on the various factors like age, okay, race, and like gender, like male or female, and the children. So for all, the dose will be different here, and the dose deciding is depending on based on your 5-phosphate. Okay, and generally when that uricemic ratio is more, the drug activity is more here, then it requires less doses. Okay, so here is your that you can see the 50. Okay, median effective doses or ED50. So here all the combination of these drugs available in this market are based on this particular uh, 5-phosphate concept here. Okay, so this is your thyroid drug topic here. The basic principles. Okay, the introduction of the basic principles of your thyroid drugs. And the synthesis of thyroid drugs, so we'll discuss the synthesis of thyroid drugs in the next class. So I'm going to stop here.